Okay. Good morning, everyone. My name is Jerome Babate. I am the Secretariat Director of the Filipino Nursing Diaspora Network, founded in 2018. The network is based in Sydney, Australia. The Filipino Nursing Diaspora is a professional organization serving the Filipino nurses who are working and living outside of the Philippines. Actually, the network was an offshoot from the International Roundtable meeting of Filipino nursing leaders held at Australian Catholic University, held last July 17 of 2018. So the network's vision is actually to enhance the role and value of the Filipino nurses across the globe. One of our flagship programs is organizing of webinars where we invite premier Filipino nurse researchers from different parts of the world. So I'll be joined by Karen Luella Rin as my co-host and moderator for this event. Ms. Karen is actually a faculty member of Cavite State University College of Nursing and currently a PhD student at the University of the Philippines College of Nursing. Please help me welcome Ms. Karen Rin. Good morning, Karen.
Hello, everyone. Mabuhay. Welcome to today's International Nursing webinar entitled How Do Healthcare Professionals Correct Misinformation in Social Media? So again, my name is Karen Luella Rin, and I will be one of the host moderator today, hosting straight here at Indang, Cavite, Philippines. Together with me is Dr. Jerome Babate, who will again be with us at the Q&A portion later. So both of us are actually very excited for today's webinar. So before we actually start with our webinar proper, let us first join me in prayer. Okay. Heavenly Father, we praise and thank you for giving us a chance to be united today. Thank you for the opportunity to care for the world and the humanity that you have made. We ask you to bless our gathering this morning and favor us with your presence as we seek your guidance in hopes to further enrich our knowledge and strengthen our partnership. Steer our intentions to align with your will and multiply our efforts as only you can. Guide our hearts and minds as we listen to what our webinar speaker will be imparting us. Bless all the allied medical professionals at the front and protect them from this pandemic. This we pray in the holy mighty name of our Lord and Savior Jesus Christ. Amen. To formally start with our webinar proper, please help me introduce the president of the Filipino Nursing Diaspora Network, Professor Violeta Lopez, for her opening remarks.
Good morning, everybody, and thank you all for participating in this webinar. As Jerome said, the FiND network strives to provide some good speakers for our webinars to inform different updates in whatever nursing and whatever international nurses do around the world. And thank you all for providing us with this information, especially those speakers that we invite from all over the world. What we would like from all the participants in this webinar is to provide us some evaluation of what you think this webinar will help you, and also some suggestions that you would like us to host during this year and of course the following year. And I hope that you will learn a lot from our invited speaker this morning about the use of social media and how we can actually use the social media in terms of providing education to nurses around the world. Again, thank you very much.
Thank you, Dr. Lopez. Now, let's hear an inspirational message from an enthusiastic educator, our very own university president, Dr. Hernando D. Robles. Good morning, sir.
Good morning. Can you hear me, Luella?
Yes po.
Okay, thank you. So good morning, each and every one of this webinar. Of course, especially to the beloved Dean of the College of Nursing of the Cavite State University, Dr. Evelyn Del Mundo, faculty and staff of the College of Nursing, your honored guest, John Robert Bautista of the School of Information, University of Texas at Austin, Ma'am Violeta Lopez of Diaspora, officers and members of the Beta Nu Delta Nursing for Humanity in USA, participants, guests, ladies and gentlemen. First, in behalf of the Cavite State University College of Nursing, I would like to personally thank you for the privilege you've given us for co-hosting this webinar on the theme, How Do Health Professionals Correct Health Misinformation in Social Media? Your chosen theme is so relevant amidst the COVID-19 pandemic. In very pandemic or any global crisis, correct information is a must. Fake news, misleading information, and incorrect account has no place, especially in social media. Being in the health professionals, you are mandated by law and by your conviction to save lives whatever it costs. Correct information can save lives, and misinformation and fake news kill. And therefore, this webinar is very timely for you health professionals to be responsible social media users. We in the Cavite State University College of Nursing and all of these colleges, as an advocacy to use social media in the most responsible way. This virtue has been implanted among our faculty members and employees by living with and living by on our core values of truth, service, and excellence. With that, I wish you all the best and a fruitful discourse on your chosen team. Thank you and God bless us all, and congratulations for these very notable undertakings. God bless us all. Be safe, everyone. Thank you.
Thank you very much, Dr. Robles.
Thank you very much, Dr. Robles.
Yeah.
Okay, so I just have a few webinar reminders to cover about this presentation and the webinar platform. First, today's webinar is simultaneously being streamed on YouTube via the Beta Nu Delta Nursing Society channel, so you may check that out too, and do not forget to like and subscribe their channel. Second, as you may notice, your microphones have been muted, but worry no more, this is just to avoid background noises. Nevertheless, you can unmute yourselves, especially later during the Q&A portion, and you can also use the chat button at the lower section of your screen to ask questions, and it will be read to you later. We ask you to please use this pattern for us to acknowledge you later, just in case you're not using your full name in your Zoom account. That's Juan de la Cruz, or your name, underscore your profession, underscore your country or the location that you are at the moment. Third is, we also have another platform. We encourage you to use Menti. Go to menti.com and enter the code 317189. Again, that's 317189. And your questions will go directly to our webinar speaker. Lastly, we would like to encourage all of you to please help us spread what is happening about this webinar in social media and share today's webinar through your social networks. At the end of the webinar, we will be sending the link of the webinar evaluation form, but actually I'm going to paste it later in the chat box, so you can just click that one and answer the evaluation sheets. All your feedback will be greatly appreciated. It will help us in conducting future webinars like this one to provide collaborative, engaging, and interactive experience for our participants. Okay, so again, today, like what I said a while ago, we are very excited because this is the first collaborative project of the Cavite State University College of Nursing and the Beta Nu Delta Nursing Society, of course, together with the Filipino Nursing Diaspora Network. Actually, the Beta Nu Delta Nursing Society have been doing series of international webinars like this one since the later part of 2019, and they've been collaborating with different agencies and institutions to give opportunity to Southeast Asian nurses to build relationship and to disseminate their nursing and health-related knowledge. So we are very privileged in Cavite State University that today they are collaborating with us. So with that, the aim of this international webinar is to first share insights, updates, and state-of-the-art knowledge from our Filipino nursing researchers to inspire nurses through the success stories of the Filipino nursing diaspora globally and build capacity and update about the latest developments and science relating to nursing and health. Okay, now let's get ourselves ready and help me introduce our webinar speaker for today. Our webinar speaker today is a Ballard Research Fellow at the School of Information in the University of Texas at Austin. He took his Bachelor of Science in Nursing degree at the Trinity University of Asia in 2008. A year after that, he took his Master's of Public Health at the University of the Philippines, Manila, and he graduated in 2012. On the same year, he enrolled for his doctorate degree and he received his PhD in Communication Science at the Wee Kim Wee School of Communication and Information, Nanyang Technological University, Singapore in 2019. Just this year, he published numerous articles in peer-reviewed journal. To name a few, because I'm telling you, there are a lot of them, is first, incorporating communication factors in the theory of planned behavior to predict Chinese university students' intention to consume genetically modified food. Another one is about nursing informatics response to COVID 2019, perspectives from 5 regions of the world. And one of his latest is entitled Seniors and Mobiles, a qualitative inquiry of mHealth adoption among Singapore seniors. As you can see, his researches are focused on the role of information and communication technologies, like the use of social media and smartphones in the work of the health professionals. He also conducted new media, like location-based advertising and social TV. His communication, he's also into health communication like mHealth and eHealth. And of course, he has a deep appreciation for nursing research. So without further ado, help me welcome our webinar speaker for today, Dr. John Robert Bautista. Good morning, doctor. You may now share your screen.
Good morning. I hope everyone is well and okay in their comfort of their homes right now. So let me just share my screen for a moment. Okay. Are you able to see my presentation right now?
Yes, Paul.
Okay. So thank you very much for giving me this opportunity to present my research on the role of healthcare professionals in correcting health misinformation on social media. So I'd like to say thanks to the FiND network, to the Cavite State University, to the Beta Nu Delta Nursing Society for inviting me in this talk. So to give a brief background, this is one of my work as a Bullard Research Fellow here in the University of Texas at Austin. So medyo maswerte kasi ito yung pinopost kong research and it was funded and I was able to do my postdoctoral research here at the university, specifically in the School of Information. So what I'm about to share with you is, I would say, a combination of my background. So, first na po akong nurse. Meron din po akong background sa public health. Meron po akong PhD sa communication science at ang postdoctoral fellowship ko po ay sa information science. So pag pinagsama-sama niyo po lahat yon, if you combine them, everything, it all boils down to healthcare professionals, health misinformation, and some concepts on social media. So without further ado, let me start my presentation by going over the outline. So I'll be going over some research background on health misinformation, and what are healthcare professionals doing about it. I'll also present my methods on how I was able to create a model on how healthcare professionals correct health misinformation on social media. Eventually, I'll be presenting some of the results in a discussion, and towards the end, we'll have some summary and conclusion. Eventually, we'll have some Q&A. So I already submitted what I'm about to present to you is already submitted in a journal. Hopefully, I would get a revision, and most likely by the end of this year, hopefully they would be able to accept um, my manuscript based on this. So eventually, pwede ko siyang i-share sa lahat. So kung ano present ko dito, this is very fresh. So it's very timely because of the COVID situation right now, and most people are aware on, have been hearing what the terms health misinformation, infodemic. So I'll be providing some background to it. So let's get started. So, okay. Hindi po ba naka full screen? Sorry. Okay. Sorry. Okay, let me just, okay. Okay. Okay, so sorry po kanina. So ito na po yung naka full screen. So we start with the research background ng ating study right now. So some of the research background. So as you all know, we're in the COVID-19 pandemic right now, and according to United Nations Secretary General Antonio Guterres, posted on March 27, 2020, our common enemy is COVID-19, but our enemy is also an infodemic of misinformation. To overcome the coronavirus, we need to urgently promote facts and science, hope and solidarity over despair and division. So as you can see, this tweet is very important because it highlights the problem about misinformation and what's the relationship with it with infodemic and what's with it with COVID-19. So as you can see, we have our frontliners who are battling COVID-19, the actual virus, but we social media users are in a state wherein we are also dealing with misinformation that can actually endanger people, especially vulnerable ones like the elderly. So um, there are several keywords that we need to somewhat give some details to before we can proceed with our actual results. So first is infodemic. So infodemic is the surge of information. So isipin nyo na lang ang infodemic, sabay-sabay na information. It's a surge of information whether it's good or bad. But the problem with infodemic is that most of the time, the information is bad and it becomes really difficult for us to find the correct information because we have so much information, we get information overload. We don't know what is real or not, what is fake or true. So that's a problem with infodemic. And once you get an infodemic, you'll have two details. So one is good information and what is bad information. But within the bad information, there are two forms of bad information out there. One is misinformation, and the other thing is disinformation. So the only keyword here is intention. So misinformation, there's no really intention to spread. So it's not really intentional that people spread it. It can be intentional, it can be not, but we're not sure whether what is it intentional or not. But disinformation is intentional. So it's deliberately misleading or biased information, manipulated narrative or facts or propaganda. So mostly disinformation, you can actually hear that in political science. So political communication sciences, wherein disinformation, propaganda, governments, etc. But for misinformation, we are more in tune in terms of healthcare for misinformation because we have some terminologies that we call as health misinformation. So recently, the United Nations seeks to counter COVID-19 misinformation with digital first responders. So who are digital first responders? These are your typical social media users who are being asked to share good information so that you become a digital first responder. So that we can drown health misinformation, we need people to actually post correct information and to some extent have some people that would correct those misinformation. So eventually those digital first responders, so they're very a digital first responder is any person so on social media. But look at this. Healthcare professionals, although some of them are in the front lines, some of them may not be on the front lines right now, and they can be social media influencers. So currently right now, there are many nurses and physicians that are social media influencers right now, and healthcare professionals are ideal to become digital first responders. So there are several articles that tells us that what should healthcare professionals do to correct health misinformation? But unfortunately, the literature is mostly on encouraging them to correct health misinformation. Like there's some articles posted by the American Medical Association about ways to counteract medical misinformation. Recently on the British Medical Journal, there's this editorial which is about going viral. Doctors must tackle fake news on COVID-19 pandemic. But the problem in terms of current research landscape right now is how do they do it? We don't really know how they actually do it right now. It's just that we just encourage them, but there's no research right now that tells us how did they do it. So um, that is one of the background of my research, which is we're asking them to correct health misinformation because they're healthcare professionals and we know that they have the background and expertise to actually correct misinformation. But how do they do it? So in terms of the research objective, I would like to develop a model that illustrates how healthcare professionals correct health misinformation on social media. So the picture that you're seeing right now is the actual model, but in the results we'll dig deeper on what are some of these details that are within that figure. So it is significant theoretically because currently there's no model on how healthcare professionals correct health misinformation on social media. Currently, research is only limited with how healthcare professionals authenticate health information on social media, but it's not to the point of that they are correcting it. In terms of practical significance, the findings of this study can help them improve how to correct misinformation on social media. So I'll be also providing some practical tips for us, like nurses or allied healthcare professionals or physicians, on how to correct health misinformation on social media. So let's move over to the methods of my research. So in terms of method, data collection. So emphasize ko lang sa lahat na before we actually do research as much as possible, we need to get ethics approval. So the first step is to actually write ethics approval. You use the template of your university, apply for ethics approval so that, because most journals would actually ask this detail, like, do you have ethics approval before conducting your study? So I did the ethics approval last year. Then by early 2020, which is January to March, I did some online semi-structured interviews because of the COVID-19 pandemic. So I was doing the research while COVID-19 was developing globally. So at the time, I predict that my participants is not something that I can geographically go to. So I did my interviews online. So I use Skype and Zoom. So for some PhD students there or researchers, kayang-kaya gumawa ng research online, which is kahit gumamit ng Zoom or Skype, you can actually record the audio during the conversation for your transcripts. Then I did some snowballing in terms of recruiting my participants. So the difficulty here is you actually need to ask participants to allow you to interview them. And what I did is that I asked for referrals. So one interviewee led to another interviewee, and I also did social media hopping, which means that so there's a person on Twitter. I followed that person on Twitter, sent that person a message. That person has several followers. I try to follow those people until such time that I was able to interview about 15 medical doctors and 15 registered nurses in the US. I was limited to healthcare professionals that are MDs and RNs in the US because they mostly comprise the health workforce in the United States. And I didn't really find so much other healthcare professionals from other fields that I'll be able to interview on social media. So in terms of data analysis, I use Pandit's approach to grounded theory analysis. So it's a much higher level of thematic analysis. It's not thematic analysis, it's grounded theory. Thematic analysis, you just uncover themes, that's it. For grounded theory analysis, you need to create themes, then you need to link one theme to another to create a process, to create some form of model of framework to explain a certain phenomena. And I use Max QDA 2018 for my data analysis as my qualitative data analysis software. So with that, let's proceed with the results and discussion. So unlike quantitative research, mostly for qualitative research, you can combine both the results and discussion at the same time, because that's how you present usually the qualitative findings. So let's start first with the participants' profile. As you can see, most of the for medical doctors, there's a balance, but for registered nurses, since nursing is a female dominated profession, there are more females. And in terms of age, they're middle adults. So it only tells us that these are the younger generations of healthcare professionals, which are social media savvy. So all of them have social media profiles right now. And actually interviewed several of them that come from different practice areas. So where you're trying to interview people as much as possible, you want to do maximum variation sampling, which is sampling that involves lots of different perspectives. So there's a perspective from cardiology, some perspective from pediatric nursing, and different perspectives so that you're able to get rich data from your interviews. So in terms of social media use, if most likely a certain healthcare professional in the US, if that person is a social media influencer / healthcare professional, that person would definitely have a Twitter. So if you would like to start your social media presence, I would invite everyone to have their Twitter account. Eventually, if you get influence and get more followers, you can have your Twitter account to be validated with a blue icon with a check. So some of them would have Facebook, some would have Instagram, LinkedIn, YouTube, Doximity. So Doximity is a social media application usually used by medical doctors. So a few of them use it. Some are Snapchat, a few are using TikTok, Pinterest. Interestingly, for TikTok, there's some social media professionals that are posting health videos on TikTok for health education purposes. So yan, sikat na sikat yung TikTok na yan. So it's one of the newer avenues to reach out people which are from the younger generations. So first question is that, how do healthcare professionals correct health misinformation on social media? So based on the analysis of interview data that I got, the way that they correct health misinformation on social media comprises of two acts. So first is the acts of authentication, and second is the acts of correction. So let's go deeper into the concepts being presented here. So acts of authentication. So the term acts of authentication, I adopted it from Tandok et al. Study on audiences' acts of authentication, which is from journalism research. So in their research, they actually propose a framework on how news audiences authenticate information on social media. So I try to adopt their framework and try to adapt it into my context, which is how do healthcare professionals authenticate health information on social media. So there are two processes here. You have your internal acts of authentication, and you have your external acts of authentication. So the internal acts of authentication can be the self, the source, and the message. Then, if needed, they may want to perform some external acts of authentication, which is clicking the link, background checking, checking past posts, or cross-matching. We'll be going to discuss each of them right now. So first, internal acts of authentication itself. So just imagine yourself, you see a health information post on social media. The first thing that you would look at is whether this is true or not, whether is it misleading or actually true. And for healthcare professionals, they actually use their own knowledge, their clinical knowledge, their skills, training, background to authenticate health misinformation. So I quote, "I recognize if it is health misinformation if it's a topic that I know. I know the science, and I know that's health misinformation. So the first thing that they actually do is to see whether it's correct based on their own knowledge. Next, they actually, next is that when you look at the social media post, you actually want to look at the source. The first question here is it posted by a reliable person or organization? So some of the cues that they look at here is that, is this from a legitimate healthcare organization? So does it come from the World Health Organization? Does it come from the Centers for Disease Control and Prevention? If it's an organization, if a person, does the person has an RMMD in their social media profiles? So if you would look at some Twitter profiles of healthcare professionals in the US, they actually like to write, for example, me, John Robert Bautista, RN, MPH, PhD, so that it serves as some form of credibility cue that you're an expert on something. To some extent, there's some that would like to see the presence of a check mark for verified accounts. And to some extent, I was able to actually ask them, what are some of the sources of health misinformation? So, sino ba yung mga nagkakalat ng misinformation? So, to some extent, they actually mentioned that these are posted by people, random people. They don't actually know who they are. To some extent, there are some people, some participants mentioned that it's anti-vaxxers. Some mention family, friends. So, pag meron kayong group chat sa social media among your kamag-anak, minsan may isang family member or friend na minsan nagkakalat ng mga fake news or health misinformation dyan. Eventually, there's some people that health misinformation is posted by those with anonymous profiles. But what is interesting here is when you look at the experts, to some extent, it's not because you're an expert, then what you post is already true. There's sometimes that experts can actually post misinformation because the details are not updated or there's some lapses in judgment. So there are lots of sources of health misinformation, and the ones that I presented here are just some examples of it. So after you check yourself, after you check the source, now it's also, healthcare professionals also check the message, the actual content. For them, these are some of the cues that something is a health misinformation. So first is that it appears like an advertisement. So there's this feeling that if someone is selling a product and uso to sa mga supplements, dietary supplements, weight loss. So they would, some misinformation would say, oh, take this pill and you would immediately lose weight within 1 week. So that's already a health misinformation. Next is conspiratorial tone. It means that, for example, the government is hiding something. For example, the COVID-19 vaccine. They would say that, oh, there's already a vaccine, but the government is keeping it to their own. Next is gross grammar mistakes. So ang advice ko lang, if you're posting like a correction or you want to post something on social media and you want to present yourself as a professional, as much as possible, there needs to be little to no grammar mistakes. Next is pag walang cited reference. So you always need to link some reference, and even may reference ka na link, you need to make sure that it's credible, because if it's dubious URL link like www.randomwebsite.com, it's usually like something that's not credible at all. Next is there's some social media posts that are pretending to be authoritative that would really like to use very authoritative words, but at the end of the day, they're just health misinformation. And next is sensationalized health misinformation posts, like mostly for sometimes there's some news articles that they exaggerate the headlines, and that can be a bit inaccurate in terms of reflecting the certain health information details. So what are some of the usual topics for health misinformation? So number one, at least dito sa US, is yung vaccine. So there's always a debate about vaccination here. So they usually encounter vaccine misinformation. Next is the diet, which about weight loss, supplements, and detox. Next is alternative medical treatments. They like to use the words snake oil here to reflect alternative medical treatments that are being sold as treatment, but they are not really effective. Next is cancer treatment, COVID-19, and gun control, violence, reproductive health. So there are lots of topics actually, but I only selected those topics that were mentioned by at least 3 participants in my interview. So going over, now, sometimes it's not sufficient for you to judge whether something is true or health misinformation. So sometimes the internal acts of authentication is not sufficient for you to judge whether something is true or not. So if, for instance, kunwari, in terms of yourself, you're not really familiar of that topic, if internal acts are insufficient, you may want to do some external acts of authentication. So I'll give you some examples. So for instance, when you have the social media post right there, the first thing that the healthcare professionals would do, especially if there is a link attached to the social media post, is to actually click the link. They want to click the link because they want to check whether that link is a legitimate source. So, for example, is it going to a commercial site or is it going to say a citation of PubMed? The latter of which I would generally find more reputable. Even then, you have to look at the article itself and where it's being published. So it's important to look at whether the link that's being posted is congruent with the information that that person wants to express. Next is background checking. So some participants would like to know what affiliation is that person is with. So they want to know whether, for instance, if you're part of a hospital organization, they want to know your background because one of the ways that you trust information is not only by the person itself, but by the background that they're affiliated with. So they want to look at that. Next is checking past posts. So sometimes you would see some history of their past tweets or past social media posts. Why? Because there's this belief among healthcare professionals that if they usually don't post reliable things, they won't be posting reliable things ever. So one person mentioned here that people who are going to post unreliable things are always going to have an unreliable source. Like they're not posting things from reliable sources ever. So it's a good way to actually check their past social media posts. Why? You may uncover whether that person is likes conspiracy theories or different health misinformation. Like that person has a history of posting health misinformation. Another thing is cross-matching. So just in case that a certain health misinformation post does not have a link to it, they may want to actually match that information to some sources. Like, for example, a quotation here is for me personally, because I'm a physician and I'm science-minded, I always kind of go back to the literature and go back to the original text to see if I can identify if it's true. So you go to the primary source. So you try to look for a journal article, you try to look for it in the website of WHO to see whether the details being posted by that person is actually true or not. So you do a cross-matching. So all of this can be actually done consecutively. So not all the times they would actually do it, but it is possible that one person can actually do all these external acts of authentication at the same time. So just to summarize, if we authenticate information, we authenticate it using our own intuition, like ourselves, based on how we see the source and the message. If we are not confident that we can authenticate it based on internal acts of authentication, there are some external acts of authentication that we can do, like clicking the link, background checking, checking past posts, and cross-matching. Now, once we know that a certain health information contains misinformation or false health information, they would undergo the process of acts of correction. So hindi lang sapat na malaman mong, ay mali yan. Kailangan, you will communicate it to a certain extent na mali yan, ito yung tama. So how do they correct things? So there are two processes that they correct things. So the first is what we call the correction preparation. The next is the correction dissemination. So first is correction preparation, then followed by correction dissemination. So in terms of acts of correction, they would actually, once they know that a health information post on social media is a misinformation, they would actually prepare a correction message. So this is very important for all of us because this is very practical in a sense that when we actually encounter health misinformation and should we attempt to correct that person, there are certain principles that we need to follow. I call these principles the 4 R's. So reflect, respect, relate, and reveal. First is reflect. We need to reflect on why the person is spreading misinformation. Is it intentional? Is it deliberate? Gusto lang ba niya magpapansin? Or is this a person who is somewhat don't really know so much and he or she is asking someone to being corrected? So we need to reflect. So one quotation here is try to be compassionate. Do not dismiss the patient and try to understand their post. We need compassion when dealing with misinformation because not everyone has the intent of spreading misinformation. So we need to understand why are they posting this? Because if we know why they're posting this, we can actually have a glimpse on how to approach them, on how we can actually correct them on social media. Next is respect. Healthcare professionals always emphasize that we need to be professional and we shouldn't be engaged in some kind of tug of war challenge on who is right or wrong. We don't need to be too aggressive because it can be counterproductive. So we need to be professional. So we need to always have some respect, whether it's communication on social media or off social media. Next is when we try to write our correction messages, we also need to write it in a way that people can relate. So one thing that I need to emphasize here is that the words that you write, as much as possible, you avoid jargons or technical terms. One participant mentioned that I think it needs to be put very plainly. So when you try to type correction, kunwari sa Pilipinas, pwede kayo mag-Taglish, yung maiintindihan ng mga tao. Pwede rin namang English, pero make it to the point na maiintindihan siya ng general public. So from a public health perspective, we need to understand that not all people would have good health literacy. And we need to assume that people will not be able to process health information accurately. So we need to make sure that our words on how we phrase our words on social media when we're doing correction is something that the public would understand. So tulad nga nung sabi ng isang participant, the average American has like a 4th grade functional reading level. So it's very important to put things plainly. It's important to put it in a very easy to understand terms and to do so directly. Next is to reveal. When you say reveal, ito yung pag-reveal ng tamang information. It's not sufficient that we say, this is incorrect. We need to actually say, this is incorrect because then you say the correct information. So how do you say the correct information? You actually say the correct information and you also need to put some link so that people can actually read later. So for instance, one participant mentioned that what I do is I copy a link from CDC or an open access peer-reviewed journal publication. And I post that as I state something like, as a nurse, it's important for me to present accurate information. Here's an accurate information about vaccine preventable diseases, or here's the benefit of measles, mumps, rubella in preventing these ulcers. So as much as possible, pag magpo-post kayo ng link, make sure that it's open access. It means that people can actually read it, not on a paywall. Yung minsan kasi pag nag-link tayo ng journal articles, minsan hanggang abstract lang. So make sure that as much as possible, we can find certain information that is open access so that people, if they want more information, they can read it on their own. So providing a link is very important because it somewhat increases the social utility of your correction post. The next thing is that once you have your message, once you prepare your message, you need to disseminate it. So there are different ways on how healthcare professionals disseminate health misinformation on social media. So there are four ways: private priming, public rebuttal, private rebuttal. But what do these words mean? So isa-isayin natin. Um, First is that we need to know what is the means of correction. So priming means that it's a forewarning. So rebuttal means direct contradiction. So priming means that when you were exposed to misinformation, you can actually warn people that, oh, there's health misinformation on COVID-19, and you post some facts about COVID-19 that is reliable. Rebuttal means direct contradiction. So when you see a person posting health misinformation, you actually do a reply to that person, whether it's public or private. So you can do a reply saying that, I think the information you posted is incorrect. This is I think you can read more on the correct details here. Then you add a link. So that is what we call rebuttal. Next, the dissemination can also be different. It can be public or private. Public means that everybody can see it. So minsan naka-global icon siya. It means everyone can see it. Private is for followers, or you can actually direct message a person. So when you combine them, you have private priming, public rebuttal, private rebuttal. But what are they? So I'll be able to differentiate them based on audience engagement, whether it's high or low, risk of confrontation, low or high, or social ties, weak or strong. So social ties, isipin nyo na lang ganito. Yung social ties nyo, which is strong, those are your family members. So you very well know these people. Weak social ties are random person on the internet. You don't really know them, but you may occasionally communicate with them through social media. But they are not that close to you. So that is social tie. So strong or weak. Now, um, let's start first with private priming. So yung example ng private priming is tweeting a protected tweet about COVID-19 facts with a CDC link. So ano yung protected tweet? Protected tweet is for followers only. And mostly, konting nursing gumagamit nito. And walang medical doctor among my participants do this kind of strategy. So in terms of audience engagement, mababa siya kasi protected tweet. It's not something that's visible to everyone. Mababa din yung risk of confrontation because you wouldn't be engaging in debates here with people. You're just tweeting a fact. We are not correcting someone here. But still, when you post a fact, that's a way to correct people so that they won't be able to post bad information on their own. So tulad nga ng sabi ng isang participant dito, be sure to be on the lookout and make sure if the information is giving you is the correct information to the people who follow me on social media or to my family members or friends who I know in person. And social ties is usually, since it's a protected tweet, sometimes for followers only, and these followers are usually person that you know. So my close yung social ties nito is very strong. Next is you have your public priming. Public priming is the opposite of private priming, which is instead na private siya, public siya. So publicly tweeting about COVID-19 facts with a CDC link. So most of the nurses use this, like 47%, and a third of the doctors were doing this strategy. And the audience engagement is high because it's public, so people can actually like, share, or comment about it. The risk of confrontation is a bit low because you're just tweeting facts. You're not engaging in a debate. And social ties is weak. Mostly this is spread to people that you don't know. So it can be any person on Twitter that can actually be exposed to this message. Next is what we call is public rebuttal. So public rebuttal is, for instance, replying to a vaccine misinformation post on Facebook by rebutting the misinformation and providing a link to CDC. So 47% of RNs were doing this, and this is something of an approach that doctors actually prefer. So most of them actually do this. So once they see someone posting health misinformation, they actually reply and they actually say that it's incorrect and they provide a link on the correct information. So the audience engagement is high because it's public. Anyone can reply to this. Anyone can see this. the risk of confrontation is very high. I have some participants who were harassed or bullied because they were saying that vaccine saves lives, and having vaccination is good. And to some extent, there's some people who are not agreeable to that mindset. So they may be susceptible for confrontation with people, especially for anti-vaxxers. And social ties are weak. Any person can reply to you. Any person can message you. It's not something that you're close to them. So the social ties is weak. Finally, um, you have your private rebuttal. So the rebuttal and link to CDC is sent as a personal direct message to a family member who posted vaccine misinformation on Facebook. This is something that RNs usually like to do, at least on my participants, and a third of medical doctors. So it's usually done to, for example, may kamag-anak kayo nagpo-post ng health misinformation. So you don't want to publicly rebut them. So what you do is you send them a direct message, yung private message. Then you say that, I think mali po yung impormasyon na sinishare ninyo. Ito po, basahin nyo po, ito po yung tamang information na you provide the link. So the audience engagement is very low kasi usually 1:1 lang to. So between your relative and you, the risk of confrontation can be high. Yung kamag-anak nyo, ayaw niyang tinatama siya. So minsan, nagkakaroon ng samaan ng loob in terms of personal relationships. Next is social ties. Since kamag-anak mo siya or kaibigan o family member, kilala mo siya. So you actually know this person. And ayaw mong mag-public rebuttal sa kanya kasi ayaw mo ring na mamahiya or you want to take things privately. So you're using private rebuttal in terms of correcting that person. So overall, to summarize everything, so when you see health misinformation, when you see health information on social media, you need to be skeptic about it. You need to authenticate it first. You may want to use internal acts of authentication by using your clinical knowledge, by looking at the source, whether is the source reliable, and the message. Does the message have a link? Then you try to click the link. Is the link congruent with what's the message? Are they evidence-based? Are they close to reality? Does it represent reality? You also want to do a background checking of that person. You want to check whether that person has a history of posting good information or bad information. And you want to cross-match the information being posted on social media with what's recent, with literature. Once you know that that information is misleading or what we call a health misinformation, you may want to correct it. So you need to reflect first, why is the person posting it? You also need to be mindful of your words. So you need to always think of respect. Next, you need to relate. Make sure that your words are simple enough that people would understand it. And next is that when you reveal facts, make sure that you have a link of the details of it. Next is that you may want to disseminate it on 4 ways, either private priming, public rebuttal, or private rebuttal. Kung kamag-anak ninyo, siguro pwede yung private rebuttal. If you're quite brave in terms of correcting health misinformation, you want to do it public rebuttal, wherein you actually reply to that person publicly on social media. Then you may, but however, you need to be mindful that there's a risk of confrontation. And there's some healthcare professionals that they don't want confrontation on social media at all. So I would say that if you're a beginner on social media and you want to share good information to people, what you can do is public priming. So instead, that's why I'm encouraging people to actually have their Twitter account. When you try to do some post on your Twitter about health, make sure that it's good information and it's publicly available. So you're using public priming, because when you do public priming and they see that you're posting good information, they may share that information until such time that there are more good information than bad information. So you're doing your part in terms of drowning health misinformation on social media. So unfortunately, there are some limitations with my research. This research is conducted in the US. So the experiences by US healthcare professionals might be different from those outside the US. Next is that I only interviewed RNs and MDs. Future research can actually do interviews with other healthcare professionals. And in terms of future research, I'm about to release a survey as a follow-up study on this research that would show the extent of acts of correction. To what extent are they doing private priming, public rebuttal, or private rebuttal? Next is that what are some of the factors that lead them to select a certain correction dissemination method? So those are some of the future research, and this is just one part of my research on health misinformation. So to summarize, some key takeaways here is that we as healthcare professionals, even though we are not on the front lines, so ako, RN ako, pero hindi ako nag-duty sa hospital ngayon, I can still help our frontliners by being mindful of what I post on social media. And I need to be mindful of the details that I share, because those details can be shared by one person and going to 1,000 person. So before we share something, we need to think about it and make sure that what we're posting is good information and not bad information or health misinformation. So thank you very much for the 30 healthcare professionals that agreed to be interviewed to my university, for providing me the funding to FiND, for Beta Nu Delta and Cavite State University College of Nursing for organizing this. So thank you very much for your attention, and I'm open for questions.
Okay, so thank you very much for that very informative and wonderful presentation, Dr. Bautista. It is actually refreshing to be updated with researches like this, which are actually grounded naturalistically, but also pragmatic, very timely, and relevant. So again, we'd like to encourage everyone to please key in your questions on the comment or chat section in the lower portion of your screen. Dr. Babate is on it at the moment, and make sure to write your name so we can properly acknowledge you. And also, if you prefer another platform, we encourage you to go to menti.com and enter the code 317189. Again, that's 317189, so that your questions will go straight to our guest speaker. But before we go ahead and take some time for questions, I would like to call in our first reactor today. Our first reactor is the research coordinator of the Cavite State University College of Nursing. May we call in Sir Rolando Antonio for his reactions about Dr. Bautista's research presentation. Sir?
Good morning, Karen. Karen, narinig ako.
Yes, we can hear you, Sir Rolando.
Yeah.
May na lang yung audio.
Okay po. Thank you very much, and good morning to each and everyone. So I'd like to thank personally Dr. Bautista for sharing his study. And I guess that the objectives of this webinar has been met, because he was able to discuss thoroughly the result, the methodology, and how did the study took place in the US, and its relevance among healthcare professionals, particularly among doctors and nurses. Also, I would like to react that this study is useful among those professors teaching research, especially that our curriculum now has also included information technology, the importance of social media. At the same time, we are now teaching students or aspiring nurses to be more literate about the use and the significance of the social media functions. At the same time, for those researchers, I think the theory could be also utilized, or the model used by Dr. Bautista. And we can also encourage the students to be more cautious, not only the students, but also nurses who keep on posting unnecessary or information that is related to their patient's care, without the consent of their client, of course. And as a matter of fact, as a researcher, we are also encouraging the students to be more accurate and be more cautious of the Data Privacy Act before sharing something within the social media. And I hope this will be also true not only among nurses, doctors, and other health professionals, but in public in general. So with that, I am very pleased with the study of Dr. Bautista, and I hope and pray that this will be soon utilized and implemented in the practice of our healthcare professionals, especially nurses, because we do encourage nurses to be more scientific in their practice and be more evidence-based, utilizing those theory as what has presented by our uh, resource speaker. Thank you very much, sir, and God bless.
Thank you very
Ayan,
much,
thank you very much.
Sir Rolly. Okay, now let's hear another reaction from another nurse educator, this time from the Department of Education, Region 12. I'd like to call in Sir Ian John Miramon. Are you here, Sir Ian?
Karen, unfortunately, is not in the Zoom platform at the moment.
Okay.
So we can proceed.
Okay.
There are questions on the Menti platform. Probably we can do that.
Okay.
Yep.
Okay, Dr. Bautista, first question is anonymous. Okay, how can I prevent confrontations from happening if I use one of your key strategies, let's say public rebuttal? You're muted.
This is something that I actually thoroughly ask the participants. How do they prevent confrontation? The answer is simply, there's no way you can prevent confrontation. Especially if you're correcting health misinformation on vaccination. It's possible that you can be swarmed by people. Like they would go together and harass you, like saying that you're endangering the lives of children, you shouldn't be a healthcare professional. To some extent, there's some healthcare professionals that they experience being given negative reviews on Google or different health professionals rating websites because they're saying that they're advocating vaccination, etc. So to a certain extent, you need to acknowledge that confrontation is inevitable, but how you manage the confrontation can be adjusted. For instance, there's a certain extent that healthcare professionals just post the correction, then they don't reply back. They just want to say this is the correct information. It's up to you whether you want. It's up to you whether you want to use it or not. As a healthcare professional, I have the responsibility to provide the correct information, and it's up to you to decide whether you would you would take it or not. And to some extent, there are some healthcare professionals that they actually block these people on social media, unfortunately. And some had like they stopped using social media for 1 week. So there are different ways of coping this. But one of the practical ones that I've heard is that they just post and they don't look back to it. Because sometimes when they look back to it, there are lots of hateful messages there. So you need to acknowledge that confrontation might not be inevitable. So you need to, that's the social reality. People have the right to their opinion, especially here in the US, wherein you have the freedom of speech. So still, as a healthcare professional, we need to be respectful. We need not go down to that level that we need, yung parang kailangan yung patulan pa. Our work as a healthcare professional is to provide the correct information. And as long as we provide the correct information and we did it in a manner that is respectful, okay na yun. So that's it.
Thank you, Doc. Another question is, meron po ba kayo practical tips and proposed solutions for managing fake medical information?
Okay, so this is one of the very important questions. So this is a very good question from our anonymous participant that The practical tips are actually not really that super practical because it can be a short term or long term. Short term is that as we social media users, as social healthcare professionals, we can actually start with our own community in terms of sa kamag-anak. Pansin niyo may mga group chat tayo. So in our group chat, sometimes there will be relatives that would post health misinformation. We may want to deal with them first before we can go public. Next, we can actually share more correct information so that instead of false information, ang makita ng mga tao is yung correct information. But in the long term, we as healthcare professionals, we need to emphasize on health literacy. Unfortunately, literacy in the Philippines is not that high, especially among old people or yung tinatawag nila sa literature na yung boomers. So minsan may mga memes yan na, okay boomer. So minsan may mga ganun na reply. So, but still, we hope that future generations will be more health literate and more social media literate so that we can avoid the spread of health misinformation. So, tatandaan natin, ang misinformation, it has been down in history. So, since olden times na may mga chismis, then yung chismis ngayon nag-circulate na sa social media, which is mas mabilis, unfortunately. So, we need to acknowledge that misinformation, whether it's health-related or not, has been there since the beginning of time. But it's more amplified by social media, and what we can do right now is to be a responsible social media user. If you want to post health-related information, make sure that it's correct, it's accurate, and just in case na nag-post kayo ng health misinformation, siguro magbigay kayo ng statement na, sorry, nag-post ako ng ganito, or you can just simply delete it so that it wouldn't get shared at all. So that would be my response to that.
Okay po, thank you. Another question is from Sir Jerome. I wonder if healthcare professionals can potentially work with social media companies to take down harmful posts. What roles do social media companies play in the spread of misinformation?
So one of the participants worked with TikTok in terms of how to best frame how posts from healthcare professionals can be yung mas ma-promote siya. So healthcare professionals can have certain influence on the platforms on social media. It's just that we need to be, I would say, there needs to be a certain group. It's not just one person. So the one that would lobby needs to be a certain group, a very influential healthcare group. And that's the one strategy that they're actually doing. For instance, there's what we call here in the US the Association for Healthcare Social Media. So this is an association that's actually specific for healthcare social media, and they do have some communication with social media companies in terms of providing some insights on how healthcare professionals can better use social media, and to some extent how social media platforms can better relay health information and to reduce the spread of health misinformation. But unfortunately, it's not only a matter of person, like a person doing his part. It needs to be on a technical level, which is what they call the algorithmic part. So to what extent do people get exposed to health misinformation is not only a matter of responsibility among healthcare professionals, but to the healthcare for the social media companies as well. So they need to fix their social media algorithms para pag may nag-post ng health misinformation, it wouldn't get exposed to many people kahit marami pang mag-share nito. So that's one of the big problems right now, which is how do we minimize the spread of health misinformation in the technical part side of things, the IT side of things. So healthcare professionals do have a role in providing insights to actually find a solution for that.
Okay po. Another question from James from QC. How to develop a Twitter tweet containing only 280 characters summarizes findings from a complex study. Any suggestions po?
Ayan. So it's just like this. How would you condense your PhD thesis in an abstract? A PhD thesis is like 100,000 words, like 80,000 to 100,000 words. How would you condense that in, let's say, 500 words? Some abstract would be 200 words. So for instance, in a tweet, there's some strategies. For instance, instead na sasabihin mo Philippines, you can just put a flag of the Philippines to say this study from the Philippines. So this study from flag of Philippines. So people would be literate enough to know that that's a flag of the Philippines. Next is also to have key points. You don't need to share all results of that research. There are always highlights in that research. So if dyan papasok yung creativity. Any sinasabi nga nila that a good teacher is able to explain things no matter how complex it is. So it's really dyan papasok na yung the art of posting tweet. Pwede, yung iba naman, they actually sacrifice a bit of grammar. So in pinapaikli nila yung mga words like, for example, to go instead na T-O-G-O. So ginagawa na lang number 2 and go. So you can actually sacrifice a bit of grammar as long as it's justifiable so that you can put as much information as you can. So buti nga yung Twitter na dagdagan na ng characters eh. Dati nga pang 140 lang yata yun. Ngayon naging 200 plus. So there are much more insights there. Siyempre, kung Facebook, you can actually post as much as you want in terms of the content. But Twitter is actually good because it gives you a brief and concise way of communicating things. It sacrifices the length and the content, but its advantage is more on focusing on what is important. So, ang practical tip ko is you can sacrifice a bit of grammar. You can use emojis or emoticons. And you need to focus only on the very important topic if you want to share details of a certain research project.
Okay po. Another question, what is the most effective strategy or strategies to address this important public health problem, like health misinformation?
Ito yung even scholars wouldn't be able to answer this right now. This is a very difficult thing to answer, but isang hunch ko is that we need to improve the health literacy of people. The problem is that to some extent, the basic literacy hindi nga natin na-meet sometimes. For instance, there's some unfortunate that some of our children don't have proper classrooms to do their to learn more about the world. So ngayon na nag-shift into virtual online learning, there's some people that don't even have their smartphones or even access to the internet. So even the basic literacy skills, we have a problem meeting that. What more health literacy skills, which is you need the basic skills to move forward to get health literacy. So in the long term, health literacy is very important. Next is that we also need to be mindful of social media literacy, wherein what to post in terms of privacy settings, etc. So yung health information, like, do we consider it a public health problem? Yes, kasi yung United Nations nga sa WHO, ine-emphasize lagi na aside from the virus itself, health misinformation about COVID can actually potentially kill people. Actually, it has killed people already. So in the long term, part actually ng ating universal healthcare law is improving health literacy. Next is, what were the demographics of the participants? Ayun, siguro medyo na-miss niyo tong portion na to, but it's mostly RNs, MDs, and they're middle-aged adults, and they come from different specialties like pediatric nursing, public health nursing, emergency medicine, etc., internal medicine. Next question.
Next question po. What do you think would be the best strategy in correcting health misinformation if it's coming from the high elected officials? Example, using gasoline as a form of disinfection.
Ayun. So for me, replying, for example, nabalita sa news na ganyan, we can actually post something na this has been refuted by the World Health Organization. Actually, merong page yung World Health Organization about the COVID, like COVID Mythbusters. You can actually put a link of that COVID Mythbusters. There's some information there about chloroquine, about yung pagbibilad sa araw, about 5G network causing COVID. So you don't really need to engage in lengthy debate. You just want to say that is inaccurate. Here's a correct information that on WHO that says that using gasoline is or other products like alcohol is not effective to prevent COVID-19. So as yun nga yung ina-emphasize ko, you don't need to be in a debate. Mag-post ka lang, that's it. That's your role as a healthcare professional. If that person is willing to learn more, you can do it privately. Like you can engage in a direct message. Kasi kapag public yan, hindi matatabunan na yan ng mga posts. So next question is, are the assumptions of the study that the healthcare professionals are e-health and m-health literate? I would say that they are e-health, m-health literate for the fact that healthcare professionals, at least right now, most of them are middle-aged adults, and all of them have Twitter profile. And for you to use Twitter effectively, you're not just using it on your desktop, but also using it on your mobile phone. So I would say that they would have good e-health and m-health literacy skills. However, malalaman natin yan sa survey ko. Part of my survey questions in my follow-up study has a certain question about e-health literacy. So I'll be able to make a connection whether e-health literacy is connected to a certain strategy on correcting health misinformation. So hopefully, I would present this by next year kapag nagawa na yung study as a follow-up to this research.
Yeah, yes, Doc. We are all hoping for that. Another question is, doctors historically have been cautioned against engaging with social media in a professional capacity due to the risk associated with the blurring of personal and professional boundaries. Any insights?
Yeah. Historically, that nung nagsisimula pala yung social media, even as far as like 5-7 years ago, healthcare institutions are not generally supportive of their staff being on social media because they see social media as a risk. But to a certain extent, through time, professionals are much more aware on the privacy risk. On like, for example, as much as possible, you don't share a post that would identify a patient. Basic na yun. Alam na nating lahat yun. So through time, certain rules were set and healthcare professionals are aware of that. So it's actually the opposite now, at least in the US. They are now encouraging healthcare professionals to be on social media because that's one way to promote the organization. Nonetheless, healthcare professionals are still cautious here. You can actually, when you look at their social media profiles, you will actually see this quotation. Opinions are mine and not of my institution. So there's always a disclaimer that says that the opinions of mine does not represent my institution. But people can actually backtrack on that this person belongs to an institution. And minsan, yung healthcare professional to, pina-follow niya yung healthcare institution niya na Twitter profile. So I would say that it's not as worse as before, that healthcare professionals are very mindful, but they see, at least in the US, healthcare institutions now are encouraging their healthcare professionals to be on social media, to be visible, because that's one way to actually promote the activities of the hospital. For instance, recruiting potential nursing students. You can actually, if you are a faculty of Cavite State University, you may want to use your social media platform as a way to recruit potential nursing students. So would your institution wouldn't like that? Yes, they would actually like that kind of advertisement, diba? So things are changing. People are now, at least institutions now are seeing social media as an opportunity and less of a risk. Unlike before na mas mataas yung risk kaysa opportunity.
Okay po.
May certificate. Opo, kaso hindi po mapipirmahan yan.
Meron po. May certificates po tayo.
Salamat po sa mabuhay po ang organizers ng webinar.
Okay. Meron pa po, sir?
Yeah, I don't think we have
okay.
other
Yes.
questions. So thank you very much for the participants.
So
Ayun,
thank you
may
very much.
nabasa pa akong question dito. Follow up ko lang, may nabasa pa akong question dito.
Apo.
Do you suggest that this topic be a special topic for a health education subject for BSN undergraduate students? Actually, may tatlo to eh. May tatlong relevance to eh. Una sa health education. So we can ask our nursing students to educate their followers on social media as a class activity. Like, pili ka ng link, then pagandaan kayo ng Twitter post. Then you can judge, you can peer review each other's post. Paramihan kung sino yung nakakuha ng maraming share, likes, and even followers, di ba? You can actually use that as an activity. Next, we can also add details more of our nursing leadership management on in terms of professionalism. Yung how do you present yourself on social media? So we don't need to it's already emphasized in nursing that we need to present ourselves professionally, but we also need to extend that not only to interpersonal communication between patients and between our patients, but also to the entire social media, which is you need to present yourself professionally sa social media din. Kasi that's a reality. Even your private profile can be public. Anything that you post on social media can be used against you. So, papasok dyan yung jurisprudence and yung leadership management. And finally is yung sa fundamentals of nursing, yung sa healthcare communication. So, ang communication natin sa healthcare is not limited to interpersonal, but it's also mass media na. So, yun po.
Thank you
Thank
very
you very
much.
much. Yep, go ahead, Karen.
I guess that's it. We're able to cover every questions.
Yep.
I just want to thank Dr. Robert for the very good presentation and your suggestion for your ongoing research is going to be very interesting, and we look forward to hearing your next project next year.
Thank you, Dr. Lopez.
Thanks, Violet. Karen?
Okay, so yes, in every beginning, there is always an end. And at this point, I would like to call in the dynamic dean of the College of Nursing of the Cavite State University, Dr. Evelyn Del Mundo, for her closing remarks.
Thank you, Ma'am Karen and Sir Jerome. Pleasant good morning to all of you. We have reached the end of this international webinar, and it is my task to provide some closing remarks. It is a privilege and an honor to be entrusted with such an undertaking at a gathering of professionals from different parts of the world in the fields of nursing, government, industry, academe, and other allied health sciences. May I take this opportunity to extend our appreciation and congratulations to our distinguished guest speaker, Dr. John Robert Bautista, a Ballard Research Fellow from the School of Information in the University of Texas at Austin. He presented to us the development of a model that shows how healthcare professionals correct health misinformation on social media. These research findings and the presented framework between acts of authentication and acts of correction are very timely and fresh. Dr. Bautista has given us his views that brought many issues to our attention, and all its dimensions are highlighted. This ensures high level of participation and the impact and handling of correcting health misinformation in social media by healthcare professionals. We are looking forward for your next research, Dr. Bautista. A sincere thanks to our Cavite State University President, Dr. Hernando D. Robles, who supported us all throughout. We are valuing your presence, Sir Robles. We are also grateful to our colleague, Sir Rolando P. Antonio, our reactor from the CBSU College of Nursing. our college research coordinator, who have greatly contributed to our discussion through his reaction. We've achieved so much in the time we've been here and gained a lot ourselves too. With our great gratitude to the organizer of this event, the Filipino Nursing Diaspora Network, Nursing for Humanity, with Professor Violeta Lopez as the president of this prestigious organization. Congratulations, ma'am. This is in collaboration with Beta Nu Delta Nursing Society and Cavite State University College of Nursing. I would also like to extend the CPSU committee's appreciation to organizer for your dedication, efficiency, and hard work to make this international webinar happen. Well done all. Knowledge sharing is an important part of what we do. This is to let you know that we became your online community, our digital channel for knowledge sharing, and us as good digital first responders to counteract and reduce medical and health misinformation, particularly in technical side of it. Before we have our lunch and say goodbye, I would like to now say thank you to all our participants, deans of different university and schools of nursing and other allied health sciences, colleagues in the nursing profession, be it in hospital and in the academe, and from other related sciences. It is my great pleasure that you stay with us and had fruitful discussions. As with all such events, and this webinar has been an outstanding example, our minds have been assailed by a flow of ideas, informations, challenges, reactions, and visions. And it will probably be a day or two before we can sort through them all and consolidate our own personal perspective. There is indeed plenty to reflect upon, and if this in any way enhances our individual and collective contributions in meeting the social media challenges, then the webinar can truly be pronounced a success. This event is finished, of course, but it doesn't really stop here. And it will soon be time to be thinking about organizing the next one. I have enjoyed totally too. I wish you all a safe journey home, or as they say, stay safe at home. And I look forward to seeing you in another webinar session. Thank you very much. God bless us all.
Thank you very much, Dr. Del Mundo. Okay, I would like to remind everyone that the link to the evaluation form is already in the chat box, so you may click that for you to be able to get your certificates. And at this juncture, I would like to thank the Cavite State University administration, of course, headed by our university president, Dr. Nando D. Robles, and the Beta Nu Delta Nursing Society, and of course, the Filipino Nursing Diaspora Network. Thank you, Sir Jerome and Dr. Bautista for today. And thank you everyone for attending this international nursing webinar, and we do hope that you have learned so much. So again, this is Karen Llewellyn. Till next time. Goodbye po.
Thank you very much, Karen. Someone is asking about the link of the evaluation form. Can you post it again, please? Thank you, Karen. Yeah.
Okay, it's posted na po. Can everybody see it na?
Yep.
Okay po.